Hi everyone, my name is Felicia Goni, and today I will be talking about a multidisciplinary approach in patient care. Some learning objectives we are going to identify the multidisciplinary approach in patient care technique, analyze areas of benefits and disadvantages in this approach, evaluate certain specialties where this approach has been used, assess the impact of a multidisciplinary team in healthcare today, and propose recommendations on how to apply nursing to this approach. So, some background to this technique. We all know that nurses see the patients most of the time. The patients see the nurses usually right when they wake up, throughout the day, before they go to sleep. But even though this is true, they may not know what happens behind the scenes, in which there's the nurse talking to the doctor and other healthcare professionals, keeping each other updated regarding patient status, patient health, giving each other ideas and recommendations in order to achieve efficient improvement in patient care. So this all happens in a multidisciplinary team approach. So a multidisciplinary team approach is a collaboration with healthcare professionals, including the nurse, doctor, physical and respiratory therapist, social workers, speech therapists, and so on. Some of these healthcare professionals may not be included, and some there might be more. It just depends on the specialty. And so these people work together to enhance patient care and satisfaction. This approach has given positive results for the patients and the healthcare professionals. Positive results include improved communication, optimized patient safety, and teamwork. Although these have many benefits, this collaboration has yet to be used in all of healthcare, but it is slowly expanding. So why is it that others have yet to use this approach? Today we will further assess certain benefits and disadvantages that take place when this approach occurs. So in study one, researchers wanted to explore the perception of a multidisciplinary team approach with organizational leaders. So they took 492 healthcare executive employees in the American College of Healthcare Executive Leaders, and the employees had to answer a questionnaire in which they expressed their opinions, experience in regards to a multidisciplinary team approach. Results show that there were advantages in collaboration, coordination, cooperation, and communication. Different approaches in problem solving was a common disadvantage. Limitations to this study included that the study's respondents were homogeneous and that they were mostly white and male. And also, only a few of these leaders had clinical backgrounds as well. In the second study, the researchers wanted to better understand the characteristics of a multidisciplinary approach in pediatric oncology specifically. And so 33 healthcare professionals in a pediatric oncology care in Canada were interviewed regarding this technique. Participants included oncologists, nurses, child life specialists, and social workers. The results showed that many of these participants found it very rewarding and beneficial in receiving and giving emotional and social support, especially with cancer patients. New access of knowledge and skills from working together occurred, and value in team members. Limitations to this study included a gender imbalance in which most of the participants were female, and participants were only from 4 of 16 oncology centers in Canada. In the third study, researchers wanted to investigate the impact of proper training for a multidisciplinary team approach in patient care and see if there is any effect to that. 67 nurses and first-year medical residents were paired up into two groups, in which one group were trained with were trained for a teamwork approach, while the other one did not. And both of these groups were assigned to perform a CVC insertion in assimilation. The results showed significant differences between the untrained and trained groups, in which During the simulation, improvement in skills were demonstrated by the trained group, but limitations to this included that residents of this study had less experience compared to the nurses who were experienced. Another study was that researchers sampled 219 patients, 18 physicians, 15 nurses in South Korea regarding their needs and opinions with healthcare service in relations to a multidisciplinary team. These researchers in South Korea wanted to design a service methodology to advance this team approach for chronic disease patients and medications. The results showed that healthcare professionals want pharmacists to provide a patient individualized service to decrease risk of drug-related problems and to improve patient medication compliance in regards to this approach. Limitations included that participants were only surveyed in a certain region, so it cannot be generalized as well. With the fifth study, researchers wanted to investigate the impact of a multidisciplinary team and their outcomes with cardiac care unit patients. So Fanari and others looked into cardiac care unit patient cases in the Christian care health care system, and they assessed the impact of a multidisciplinary team. The result did show that there was a decrease in hospital mortality and a significant reduction in cardiac care unit length of stay due to this approach. Limitations to this included that this is a single center study, so we cannot generalize other CCUs. Other improvement factors could have impacted the improvement in patient care as well, but other than a multidisciplinary team approach. In the last study, researchers such as Bilfinger and others evaluated survival outcomes of lung cancer patients who were being treated with a multidisciplinary care team compared to those who are being treated with a traditional model. Excuse me. These researchers identified lung cancer cases in Stony Brook Cancer Registry and Lung Cancer Evaluation Center. The result showed significant beneficial effect to those using a multidisciplinary team approach in patient care, benefits in communication as well. Limitations to this included treatment biases and referrals that have affected provider practices. Study findings also showed that study findings were also based in the Northeast and not throughout the country. So, as you all can tell, there were a lot of similarities in benefits and disadvantages in using a multidisciplinary team approach. We saw benefits regarding effective treatment, improved communication was a common one. Team members received good support and valued contributions for each members. Just like the study in South Korea, they noticed that pharmacists definitely play an important role in this multidisciplinary team. Effective coping strategies. For example, we talked about specialties such as oncology, pediatric oncology, and lung cancer patients. Effective coping strategies were presented for these team members in dealing with ill patients and death. Lung cancer patients also had survival benefits due to this. So we can see that there are a lot of similarities in the positive, but also in the negative. There was role confusion, feelings of undervalued, miscommunication, and confusion in team structures. For nurses, with this approach, nurses, like I said earlier, commonly see their nurses more than other healthcare professionals. So as nurses, we have this responsibility to update information as messengers to patients and also to other team members. Healthcare professionals, not just nurses, are able to give each other support and cope with one another when death becomes an issue. With this teamwork, other healthcare professionals are able to keep an eye out on each other, also to prevent burnouts and to prevent overwhelming responsibilities. So the researchers, such as Han, suggest more research in different regions and countries, and and in other healthcare facilities. We saw that was a common limitation. Recommendations for nursing when using this approach is effective treatment and effective communication. We need to make sure that we listen to our patient well, good communication, good assessments, keeping other healthcare professionals updated on patient status, and also communication with families as well. As advocates for our patients, we have the responsibility of being in between the patient and healthcare professionals. We can be the messengers for both of them. So we can definitely take this approach to an advantage. We can continue to be able to improve patient care by being a part of a team. So, in conclusion, a multidisciplinary team approach provides many benefits in the healthcare environment and for the patient, nurse, and other healthcare workers. Even with the benefits, there are disadvantages regarding this approach that have been noted. This approach, though, is still expanding and being used not just in the US but across the world. So, even though these patients see nurses most of the time, what happens behind the scenes or behind the curtains is also very important and vital in caring and in maintaining an effective patient care treatment. Because with teamwork, teamwork can really do so much, and all of these healthcare professionals have one certain goal and one aim, and that is to care for the patients. And so these are my references. Thank you so much, everyone, for listening.